not currently enrolled in OPWDD, and then the different challenges that that presents. So I am looking forward to hearing what you all have to say, because I have about this much knowledge when it comes to housing. And I don't think that's uncommon. I think that, there's a huge housing crisis, and I don't think a lot of people understand the process or the possibilities. So I'm glad you guys are here. Thanks for coming.
So just so y'all know, I'm on YouTube Live now, so I'm recording from my phone. I do apologize, but so hopefully this will sound okay, but you are microphoned up there. So we're gonna get started with some questions. I don't know if that was a question, Britt.
No, not really a question. Why don't you guys introduce yourselves first, so that,
Yes.
we have an idea of where you're coming from.
Yes, and what your organization does, okay? So start with you, Heather.
I'm Heather Burrows. I'm the Director of Advocacy at Autism Up. And they recruited me because of the housing issue, primarily. They had a lot of families coming to them saying that they just couldn't navigate the system. And as you had mentioned, there are a lot of people who don't get through the front door. And the analysis that we did was really eye-opening for me, because I didn't realize that only 1/3 of the people who have an IDD in New York State have OPWDD. So instead of looking at just the self-directed options and the certified options, Autism Up has taken the perspective that we have to look at everybody and figure out how we help the other 2/3 that maybe their disability doesn't warrant that formal support, or maybe they just can't get through the front door, because there's a lot of people struggling with that. So we collected a lot of data. I'm not a statistic person. I know people will laugh when I say that, because I am rattling them off continuously, but my brain doesn't usually work that way. I'm people focused. But this report is available online, and the QR code is over there on the table. It's pages and pages of what our region is facing right now, and the legislators have responded very, very well to it. What we were getting a lot of times when we were trying to remove barriers was, we don't have any updated, relevant information. And so this whole report is just what they wanted. It's also attracted some developers who are really into making like a smart technology, smart homes in our area. So that would be super exciting, because we know how hard it is to find workforce, people to come into the home. So there's so many different elements to this. And I have a sister with autism, and I grew up with her before anybody really knew what that meant. She was just Erin. And she's almost 50 now, and I have 4 children with disabilities, and they're all incredibly different, and only one of them qualifies for OPWDD. So I think that this is a very relevant topic. Happy to share.
Hi everybody, I am Matt Fico. I'm the Director of Admissions and Engagement with the Arc of Monroe. We are an adult service provider agency that obviously, amongst other things, has certified residential housing. So I'm here to talk about more of the certified setting, OPWDD, all the hoops you have to jump through, like Heather was just basically alluding to, for getting housing within New York State for a person with IDD. And what that looks like, the process, all the different subcategories, even within OPWDD, to find housing. We also provide services all throughout a person's life, throughout the, what we call the continuum of services, so day rehabilitation, community pre-voc services, supported employment, CONHAB, recreation respite programs, family support services, including blanking on things. Family support services, including guardianship, including reimbursement, and many others.
Hi everybody, I am Josh Bielemeyer with Heritage Christian Services. I'm our Finger Lakes Housing Supports Coordinator. I cannot speak to the scope of what Everything Heritage does, because it is a lot, and my expertise is a very narrow part of that, but I primarily oversee our OPWDD housing subsidies, which is essentially the non-certified housing option, so which often we would just kind of consider housing options. So the housing options that are out there if you're not moving into like an IRA or a group home or something like that.
Good morning, my name is Michelle Bellamy. I'm the Director of Residential Services at Starbridge. I've been supporting adults with intellectual disabilities for 34 years now, and I'm really aging myself with the panel here. And most of the time has been spent in residential. It's an area that I'm very passionate about. Our residential program at Starbridge, the certified residential program, is quite small. We only have 3 certified sites. But we do offer a very robust fiscal intermediary department, family, youth, and education, family advocacy, family reimbursement programs. So while our residential scope is small, our other scope is quite large, and I encourage you to grab a flyer. I brought some over there, or take a look at our website for more information.
Great. So, I mean, back to, I guess, my introduction where I started rambling. What are the options for, and I don't even know who I'm directing it at. What are the options for housing through OPWDD versus for an individual who does not have OPWDD? In terms of supported housing, or in terms of, I guess supported, I mean, various levels of support, but.
I can speak to people maybe who haven't gotten through the front door since they're included in our report, and I know that's not what everybody else is looking at. So for people who are not formally under that OPWDD umbrella, they could qualify for different housing subsidies based on their income. But I really encourage people to look at the other resources available, the other funding streams like Office of Mental Health and things like that, because depending on what their challenges are, there might be opportunities and different options. What we're finding is the fair market rate for housing is not fair. People can't, if you're on SSI and you have a fixed income, even if you have employment, it'll be very hard to afford $1,050 for a 1-bedroom apartment every month, and that's not including everything that you need to live, right? So a lot of the people are finding that you shouldn't spend more than 30% of your income on housing, but there's no available accessible housing under that. So I think that looking at creative options, where you're sharing resources and pooling things, communities coming together and blending funding streams will be what we need to do eventually, because I pulled the figure out because there's 109,200 people in New York living with caregivers over 60, over 100,000 people. In the next 5 to 10 years, when they lose their parent, they lose their home, and they lose their caregiver. And so this is a crisis of like massive proportion. And it's not just people with disabilities are in the middle of this. There's, the elderly who are on fixed incomes, or people with mental health or other disabling conditions. So I just feel like this is the time that it's really good to bring everybody together and sit down at the same table, because each system kind of works all by itself. But we really need to figure out how we can all come together. In Utica, they did this really cool thing, and I only bring it up because it's not that far from here. There was this area of downtown Utica that was just abandoned, basically, empty buildings, churches that people weren't going to, and the town sold them, the city sold them for pennies on the dollar to the VA there, the Utica Center for Development. And so then when the veterans are coming back from tours of duty, they started fixing up the houses and making them accessible, and the businesses, and they have a recreation center that they've opened up. But it's OMH, the VA, and now they're pulling in OPWDD, which is the Office for People with Developmental Disabilities. So that seems like a beautiful model to me, because we do have lots of plazas that have open spaces. We have lots of neighborhoods where there's abandoned houses. And if we could coordinate that in some way with developers, other states are knocking down the whole neighborhood and like building up, these pedestrian style communities. So I think we have options, but it's scary if you're not through that front door, and you should be. So even if you're over the age of 21 and you haven't been able to do it, if you really think that you qualify, it's worth revisiting, because as long as you have documentation for before 21, sometimes we can get you through the door. But I'll have you guys talk about self-direction, because that's the other, like, I feel like elephant in the room. Well, certified is the elephant in the room too, right? Like, there's not a lot of options, they have a lot of openings. But with self-direction in particular, the newest information was that we just can't access all the money in our budget. So when you look at the books for New York State, it looks like we're spending a lot of money, but if you can only spend 35% of your budget, we're not really spending all that money on the people. So I wanna make sure that when we advocate, and that's where my area is, that we're advocating for those systemic changes, that we can really access the funds and the supports that we need. And I know I didn't answer the question, I don't know.
No, you did. I mean, I think it's, yeah,
I need some background, I guess.
no, I mean, you did. You answered it. You know, it is scary when somebody really should have support through OPWDD and hasn't been able to access it yet.
You need a continuum of supports.
Right.
Instead of having certified and self-direction be these two really separate entities, there should just be a continuum that you're moving up or down depending on how your needs change.
Right.
Because it kills me that my daughter with self-direction can't visit her friend at a certified setting with her self-directed staff, because that staff can't go to a certified setting because those are her friends.
Can you explain to people the difference between the certified and the non-certified?
Well, self-directed, it's just two different, it's all OPWDD, but it's got split into, and you guys might be better, I'm not gonna, I'll explain it like a parent. The two systems, I feel like, one is it was supposed to give us the power, right, the autonomy, but it gave us also all the administrative burden. So we're the self-directed, if you're in that model, it's almost a forced choice at this option, because getting into certified is really tough. But like, I'll give my daughter as an example. She has 24/7 medical needs. I always thought as a school psychologist coming up that she would end up in a group home, that everybody would take care of her needs 24 hours a day, and then I would finally be able to take a breath when that happens. But now, it's a possibility, but it's not the same possibility it was when she turned, 18 years ago when she was born. It's harder to get in. So for that model, I'm like, okay, we have to do self-direction. Like, in my mind, I've adopted that mindset, but that's another really difficult process, because we have to hire everybody. Devin has 10 caregivers, so it's like my second job, coordinating that schedule and making sure people are onboarded and trained, and if somebody doesn't show up, it's me. Like last night, I did the overnight, her caregiver was sick, and even though we have 10 caregivers, nobody could just drop everything and come over last night and stay with her. So the two separate systems, I feel like should be blended into a hybrid, and that's what I always say, because why are, it's almost like we're competing for dollars between
Well,
these two systems,
That's,
right?
it comes down to Medicaid dollars, and it comes down
Yeah,
to,
thank
double-
you.
they look at double billing. So the state looks at it as somebody who has self-direction has that, right, it's all through OPWDD, but it's a separate funding source. And it's self-directed, I mean, it's literally in the name, the families have the ability to take that budget and apply it to the supportive services they want to use it towards. Where that becomes a difficult situation is in certified settings, whether that be in daycare, whether that be in residential services. You can't
Double
combine it. So like, we often have people that, like you were saying, a person who lives in a certified setting, there's an X amount of staffing minimums that house would have. Say, for example, 2 or 3 staff during the day, 2 overnight. You can't then, if a person needs that 1-to-1 aid service for self-direction, because we have people that live in a certified setting that also use their self-directed budget towards but they chose to use it towards a certified setting. They can't then say like, well, I'm self-directed, I can also bring in a 1-to-1 aid. The state does not allow that, because that's basically it's double dipping with their Medicaid funding. So that's where that challenge comes in.
And for the complex people, it's very hard to find where we fit. Like whether it's medical or behavioral, if staffing is low, agencies are gonna be hesitant to take this, right?
There's
Because
a-
there's
yes.
a liability piece.
There's a gap. We always say that, like, the Office of Mental Health, so you have the Office of Mental Health housing, you have OPWDD housing. There is a gap in those people that have higher mental health needs, but still have intellectual and developmental disabilities. And I can speak for our agency and for most certified housing agencies that that is a challenge, because a person that does need those, we have behavior staffing in our housing. With that said, it's not 24/7. There's also not high, so a person that has a history of aggressive behavior, schizophrenia, some people who are dual diagnosed, it is a big challenge. And when we're screening somebody, we have to take into account, it's not just that person that we're supporting, it's everybody else in that home. And what's the dynamic of the people that already live in that home with that new person coming in, and what challenges does that bring, and what staffing does that bring? So there is a huge issue with finding that kind of like that middle ground where the Venn diagram comes together with people with IDD and who also have high mental health supports, and finding housing for that. And there's no perfect solution. And and like I said, people say that, well, it's self-direction. But then again, that creates its own challenges, and
How does that sustain when I'm gone?
Yes.
Like, if I'm not
And,
here, I
and,
don't
and
know
you're
who
right,
does it, right?
the family takes on much of the burden, even though you have care coordination, you have your fiscal intermediary, you have your broker. It still ultimately falls on that parent to be able to find staff, it's challenging enough for agencies to be able to find staff for a lot of our services. To find staff individually who can provide the 24/7 staffing, have backups to the backups, it's huge.
So I'm slightly confused because I have young children. So what does that process look like for somebody who's just starting with this system? Like, if you had a family member who was coming to you and wanted housing for their child, like, what does that look like for a new parent? And I think, not that Autism Up can't answer that question, but I think it'd be like down the panel. Tell us what that looks like.
So for certified housing opportunities, someone would need to go through the front door and be deemed eligible for OPWDD services. And because options are very limited for certified housing, the DDSO puts out a priority list every week. So we have to, when we have openings, we have to screen folks who are on the priority list, which is kind of a double-edged sword, because you're dealing with people who really who have the highest need for housing, but then it also doesn't take into consideration someone who's just aging out of mom and dad's home and is just ready for that next level of independence. It's a sticky thing to try to navigate. I think you would agree to that.
Definitely, yeah, and you have to exhaust all non-certified options first. So even if you have OPWDD eligibility, you still have to exhaust non-certified options before you're able to start looking at certified options. And like we're referring to, there is 3 categories within certified housing. There's current need, substantial, and emergency. As an agency with certified housing, we need to exhaust all emergency need first. So if we submit so the Arc of Monroe, I know every agency does, Starbridge. The state has, the local DDSO would have a listing of all the homes that are available. They also have a site profile of every home. So what their job is to cross-reference, okay, this person has this, basically these support needs. We cross-reference it with the home, because every home is different, it's not one size fits all. They then would send a packet to us to screen based upon that person. That's not a perfect method. Even, they're working, there's a whole new thing this year where they're trying to get more targeted. So there's a whole new, so OPWDD does, it's not like they just like, well, it's system's a system and that's just the way it is. They are trying to make it a little more streamlined. Doesn't make it perfect, but they're trying to make it more streamlined. So to get back to the point of, we have to look at all emergency needs before we can even start looking at substantial or current need. Basically, emergency need is people with the highest level of need. They're in a challenge, or they're in a situation where either they're going to be evicted, the caregiver is incapacitated, they're in the hospital, they're in a place where they need housing immediately.
Prison.
Yep, prison,
Yeah.
which that's a whole other thing, bringing a person into a home that has just been,
Yeah.
So then substantial need are family, or people that have, they are in need of housing, but it isn't imminent. It isn't like they, you know, we know that in the future, they have a caregiver that is older, is aging out, aging, or their current level of support is not gonna be sustainable, so they're gonna need housing. And current need is just somebody who's on the list and pretty much they're living with family, everything's fine, but maybe 10 years from now, they're gonna need housing. But they're just on that list. But even, we don't even get we don't even see who's on the current needs list. We get the emergency need, and that's pretty much
The
it.
OBWD commissioner just testified, there is no list. We don't know how many people need housing, and that's scary, because other states track that, like in real time, you can go on their dashboard and see, these are the number of people waiting, and these are the number of options. When you press OBWDD, not at a hearing, but behind closed doors, they'll tell you, we have maybe, if we could not look at your preferences, maybe you say, I really need my own bedroom, or I need to stay in Rochester. Like if we put all of that aside and just look at people and needs and houses available, they said that maybe they could place 10% of the people who need housing right now. I say that because they're telling us, like, we are trying, but the options are so limited that we don't have enough options. So that's what brings me back to the advocacy piece and really taking some of the barriers away so that we can try new things. Because certified is completely the safety net that most parents want. You know, you want to know that when you're gone or when you're on vacation or if you're sick, that somebody is gonna take care of your child, but it's just really hard to get into that system and feel stable. I mean, I think our area, we're really lucky, but if you talk to people downstate, they'll be in a wait 10 years for a group home, get in that group home, it closes, they get transitioned over 2 hours away, they lose their day hab. It's like this mess all over again, you know, all over, and families are getting disconnected. The one thing I did want to say, because I'm in an advocacy work group for the county, is there was a spike in our area where families were told, like you were saying, for that emergency need, if you have a house over your head and people to care for you, you're not in an emergency situation. But we had families that were getting kicked out of their homes and in shelters because they couldn't maintain their work schedule because the kids kept getting suspended, or they couldn't, you know, they just couldn't make ends meet. They were counseled to put their kids in foster care, to relinquish their parental rights. It's so hard to talk about because I can't imagine just, but they're saying basically there's no access, right? Like, so you have to escalate their priority. So now we have all these children in foster care who we don't have a placement for them either. So we like force them into the system, and it's very broken and very scary. And the other thing that sometimes happens when we're under 21 is we get sent to a different state. And that's $1,000 a day. Last year we had 250 kids that were in out-of-state placements. That's $250,000 a day New York State is paying to send them somewhere else. So
When you say kids, you mean,
under 21.
oh, okay, just double checking.
Yeah, no. So I mean, it's, when we think about those things, like, I'm so glad they categorize them, but it's scary, right? Because emergency means literally, quite literally, no one is taking care of you. My first responder friends will call and say, there's a young man with Down syndrome living under the bridge downtown. How did that happen? And I think, well, his family probably is gone, and we lost him in the system because if a care manager comes out once every 3 months, they might not know
Right.
where he ended up, and if he didn't pay the bills, he got evicted. And so we have people in really high crisis situations. So I give you guys so much credit for going through that list every week and trying to figure out who you can help. But you can't help all of them.
So I just want to cut in Heritage. You do non-certified housing, and Matt was saying that that you had to do that first before you could go to certified housing. Can you speak a little bit more about that and what that means? Like, what is certified, non-certified housing?
Yeah, so, you know, as Matt and Michelle were saying about with certified housing, options are limited. And so for that reason, there has been pretty significant growth in non-certified housing, which non-certified housing is essentially just housing. It's living independently in the community, in an apartment, in a home, either a home you bought or a home that you're renting, you know, with the supports that you need. So this is still for somebody who is receiving OPWDD services, and it's either through their self-direction budget, or if they don't have self-direction but do have OPWDD, they can still access a traditional OPWDD housing subsidy. Housing subsidy is intended to pay a portion of the rents so that the individual pays 30% of their income towards housing costs, and the subsidy will cover the rest, with a pretty big caveat that it is based on those HUD fair market values for rent. So if your rent is higher than what the next payment standard is, you will be paying more than 30% of your income. But still, it is a useful and very helpful support for a lot of people to live independently and get that, additional rent payments so that they can make payments on their rent. We support, I think, almost 300 people with housing subsidies, so they're all, living independently in Finger Lakes and Western New York area, with whatever supports each individual person needs. So some people might have Compad who work on meal planning with them every week so that they have their meals all set up and prepared. Some people might have like a Medi-Set or something so that they, it pops out whatever their daily medications are for that day so that they don't have to kind of figure that out on their own. But really the key to the non-certified options of the OPWDD housing subsidies, making sure that plan for supports and safeguards is in place. So it's really identifying what safeguards does somebody need and how are we going to make sure that those are met in an independent setting.
Just a question.
Yeah.
So I know about the self-directed part, but are there any quantity of people that use housing subsidy and use agency-provided ComHab
Yes.
to live in the community?
Yep.
That's completely their choice. So that's kind of a hybrid model because the agency is finding the ComHab worker.
Yeah, and it depends, because it could still be through self-direction. You can hire agencies
Right.
where contact through self-direction, so it can still be through their self-direction budget and have an agency contact working, yeah.
Does anybody else have any other questions from the audience? Just double checking.
By the way, I put together like a little quick, which I'll leave a bunch of these to have, but it's essentially just a quick outline of the steps that a person, and specifically for the Arc of Monroe, but again, it's probably similar to Michelle at Starbridge, for certified housing, what the steps are before you get to that point. If you don't have OPWDD, who you can contact, who you can call, and also a couple links to like the New York Housing Resource Center, which is they can provide all non-certified options to look at. It's a great,
Fantastic
resource.
website, super useful.
Yeah.
Just updated.
Yeah, exactly. I also included a link for Heather Walters, the regional coordinator for Upstate Parent-to-Parent Network, which is also a great resource. Bless you. A resource, and then the little difference, a guide between certified and non-certified housing, what that all means. Bless you again.
Can you send me that? Sorry, can you send me that as a digital copy and then I can share that with everybody?
Mhm. Yeah,
Thank
it's
you.
actually through the, so this is through like one of the resource centers, so I just sent a link to like the website to get
Sure,
all
thank
this
you.
on, but yeah, it's a housing resource guide for New York State.
Yeah, I would strongly encourage anybody who's interested in both certified or non-certified housing for their loved one to check out that nyhrc.org. Right? It is an incredibly helpful website with a lot of different resources.
That's a checklist that you can kind of walk through. They have housing navigators listed there throughout the state.
Right.
So you can connect with somebody who's trained in this area and specializes in this area, which I think is important. I would love for that to be part of our budget, to have a future planner or a housing navigator be a budget line, because we all need that when it comes to SSI and wills and guardianship and those things. It would be so nice to know that your care manager can only know so much. And they can't be an expert on every single thing, and none of us are experts on every single part, right? So it'd be nice if we could have that. I always just say what we should be advocating for, sorry. As I listen, no, there's so many things to advocate for.
Future care planning can provide help with that.
I'm
And
actually,
I
just
think
saw
you
them
could-
yesterday.
I think you could put, at least some of that in.
$450, I was told could go towards it, so.
They're great though, I mean, they literally hold your hand and walk you through the whole
They're a wonderful organization. It's very hard to get in now. I have to say, I waited months and months, and now I have to wait another
You gotta
few
plan
months after
ahead.
the first
You
meeting.
definitely
so.
have to plan ahead.
Yeah. And so if your child's approaching the age of 18, because my daughter just turned 18, I can tell you this, you can do some of SSI stuff ahead of time. Like you can go become a rep ID and start that process at your local DSS office. Some of these things help. Guardianship, I found, is what we need to do, and that takes forever, it feels like. So there are parts of the process that we want to do ahead of time, but we can't. You know, we have to wait to the birthday, and there's other parts you can. So I would really talk to your teams and make sure that you're moving along and that you have the things done that you can get done ahead of time, because it's really overwhelming at 18.
Yeah.
Matt,
The earlier you start, the better it is, because you're right, if it's just like, oh, I'm gonna wait till my son or daughter is an adult, I mean, but, and honestly, it's too late.
Yeah.
Or not that it's too late. You
But
could
it
always
feels
get-
that way,
But it
yeah.
feels, because you're starting way behind where many other families have
You
started.
lose access to everything. Wegmans Pharmacy wouldn't talk to me. In my chart, I couldn't log in anymore. And I thought,
Because-
oh my gosh, she's nonverbal and she.
Well, because that's the other
You know,
thing
what am I gonna
too,
do?
if the parent is not a legal guardian, once that person's 18, as far as the state, they're an adult. They're making their own decisions, they can speak for themselves, and you're right, there's some people that can't, literally can't, because if they're nonverbal,
Mhm.
they might be able to, there's ways they communicate that just aren't traditional, so. I think one of the other things that I did want to just touch on really quick for certified housing, it isn't as simple as a mom or dad calling, which happens a lot, calling me and saying, hey, we start touring your houses. I can't even talk to them. I literally cannot talk to them until I get a packet or the person's referred to me, because again, where are they in the process? You know, and we look at it this way too. The homes are these people's homes. So if we're just traipsing through people nonstop, and would you want somebody continually walking through your home and
No.
invading your space or whatever?
Mhm.
You know, we are very welcoming of doing tours and doing dinner visits and overnights, but there is a whole process before we get to that point. So it isn't as simple as just a parent calling up and being like, I want to look at your homes. We can't do that.
So I guess that makes me ask, a couple of questions. One, and it's probably in some of the literature that you left, but what is that very first step that a parent would take? And part two to that same question, I guess, is if a parent is thinking that they want their child to have housing 2 years from now or 10 years from now, or whatever that mindset is, how soon, at what point do you recommend somebody start that process?
And- Go ahead.
I mean, high school, so I
Yeah.
partner with Project Show in Wayne County. So it's a high school postgraduate program, and they bring their students to me every year to a couple of sites and to students and parents come. And they have an opportunity to see what a group home looks like and to interact and ask questions and just start getting those wheels turning. And I think they come to some of your houses too.
Yeah, it's exactly. It just has to be, like I said, set up ahead of time.
Arranged,
You know,
yeah.
arrange and everybody has to be okay with it. But yeah, I mean, it's not that we love showing our homes. And by the way, people I think sometimes too have an idea of what a group home is, and they think it's more of an institutional setting. These are beautiful, very well kept, very like updated homes. Like all of our homes, I would love to live in one of our homes. I mean, they're beautiful. And staff takes a lot of pride. The people that live there become like family. They you know, when unfortunately, you know, it's wild. This last year, it's going to pass away over the weekend. Had 17 people die over the last year that have lived in our group home, because we've had people that have lived with the Arc Monroe. We have 29 homes in Monroe County, and the people that have lived with us, we've had some people that have 40 years. We've had group homes at the Arc since 1970. We opened our first home. So we've had people that have been with us almost as long as we've offered housing. And we also want to make sure, like we were saying before, last year we created an idea to allow people to age in place and age with grace. So the older as a person ages, many of the homes that the Arc had were, I shouldn't say many, but a good portion of them were two-story homes, and as a person gets older, obviously their needs change, their mobility needs change, the amount of staffing they need. So we want to make sure that all the homes that we either buy or build are fully accessible, one-floor homes, so that's their forever home. Once they move there, unless they choose to move, that's where they can stay throughout their life. And so making sure that the housing that we have, not only can we bring new people in, but that the people that we currently support can stay there as long as they need to as well.
We could all break our leg and not be able to get up the stairs, right? We could all have things happen to us, so the developers that we're talking to are saying some of the same things, like creating spaces that you can age with grace. I love that. It's such a beautiful phrase. It's important for us to think in that way. Well, everything is stairs, and I was like, but where's the ramp? You know, where are my friends with wheels how are they gonna get inside? So definitely. One thing I wanted to mention was there's 724 families in Buffalo that started a class action lawsuit like a really long time ago, because they've been waiting on the list for so long. I say that not because I'm so happy they're suing. I feel bad they're in a position where they've gotten to that point, but maybe the pressure of that, you know, sometimes it takes legal action and it takes a big group of people coming together that we can shift. Like, you know, without a reason, it's really hard to change things in our state. Like there has to be a deficiency or a ruling against the state for there to be that motivation to do it differently. So knowing that 724 families have been on a wait list, I think they said for over 10 years.
Yeah, I was just gonna comment on that.
Yeah.
I feel like the being deemed an emergency is a little bit misleading.
That's
Yeah.
right.
It's gonna be 10
That's
years.
exactly
Yeah,
right.
they get housing next week, and
Yes.
you can be on that list for many, many years.
Or you could live in a hospital for
Yeah.
years.
Yeah.
I mean, we have people
Yeah.
who end up in a nursing home or hospital because their parents can't do it or aren't here.
And to pull it back a little bit to your question of like first steps, I would also emphasize the importance of having those crucial conversations with your children also, because I can't remember the statistics. I'm not gonna spew false statistics on a recording, but I do know that John Maltby of NYHRC did a study and found, parents obviously want their children to be someplace where they are safe and protected 24/7, and they want the children in something like NYRA or a certified setting. But is that really what your child wants? Or does your child want to kind of have that independence to be able to say like, hey, I did it, I'm living on my own, I'm doing my own thing. So really having that crucial conversation, being willing to, maybe take on some risk to really give your child the opportunity that they want.
Would that be similar? Maybe not similar, but there's different levels of certified, I guess, which would be good to mention, the supportive and then the supervised.
They're supervised and supported housing,
Mhm.
Yeah, so for example, we have supported housing, which is basically 24/7 staffing. 24/7, not that supervised doesn't have 24/7 staffing, but, for example, your traditional group home would be an example of a supported house. Supervised are more like apartment settings, so they are, for example, we have two different apartments. We have one, which we rent through through HUD. So there's Clarissa Street, which is over, in Fernwood. So two different apartment complexes that are integrated, so there's people from the community that's where they live. And then the Arc in Monroe rents out homes and rents out apartments within that are supervised. So people in those places are more apt to we have some people that drive themselves. They are much more independent. They have their job during the day. It's like any of us. You live in an apartment or a home, and you come back, you kind of come and go as you please. If you need support from staff, they're there to assist you. So, there's things like there's still nursing oversight, there's still behavioral oversight, but it's not as intensive as you would have in a traditional group home. So a supervised setting, again, still has staffing, but it's just not as involved in a person's life. They're involved as they need to be for that particular
Yeah, they
person.
have access to a staff 24/7, but they
Yeah.
might not have a staff in their
That's
home,
right.
in their apartment
Yep.
24/7.
Yeah,
And to clarify, that is still a certified setting, and I'm assuming there's still very few
Yes.
openings there.
That's right. Well, here's the irony is, so like right now, the ARC, again, big reason is because we've had so many people unfortunately pass away. Right now, we have 15 openings. We've had 15 we just like a month, we've filled like 3. We had 18 as of like a month ago. But it wasn't for a lack of screening, because the challenge is just because some emergency need, like I was talking before, it's that screening piece. And that's pretty intensive of like, first you have to meet that person. Then you do the tours, then you do the dinner visit and overnight. And through any part of that process, if you realize that person can't be supported, it stops and then you gotta start again.
Yeah, or they'll send you people that are just like, we can't support you.
I mentioned it, yeah, I know.
It takes a very long time.
I
to
mentioned
find that right
before,
fit.
yeah, that the whole like, where there's site profiles and vacancy announcements that as an agency we send out.
Did they read it?
You give people, we have a home that has, there's first floor bedrooms, but there's also second floor bedrooms, so it's really multi-level, so like going from like the kitchen, there's like one step, and then going down into the living room, like 2. So and the point is that they all have that, OPWDD has that on file, and they're sending us people that are in wheelchairs for that home. And so it's like you just said, did they read that? Not saying that happens a lot, but it does happen sometimes. Because OPWDD, if you see this on, don't tell me, but that does happen. And it's not like they're like, oh, they are apologetic, because sometimes I think it's just like,
They're grasping at straws too.
yeah, and that person too might have been on the list for 3 or 4 years, and again, emergency need, and they're just hoping that maybe there's an opportunity. And sometimes too, if they send up for a specific home, we oftentimes do. Doesn't mean that we have to only screen for that home.
Yeah.
If we
Right.
see that person and we're like, okay,
Right.
they may not be a great fit here, but we do have another home, so we do at least try to open it up to make sure. So if we get somebody with substantial need, and it's for a specific home, we can only screen for that specific home, so those are the other rules within.
Yeah.
So emergency need, you can kind of, depending on the home that's best supportive of that person, you can kind of find that if it's available within your agency. But there's also rules regarding those other categories that we have to follow.
So there's also one more layer. These are all voluntary agencies. They're not state-operated group homes, so that's another option.
Yeah.
They don't, I shouldn't say that. I was gonna say they don't turn people down. That sounded weird. They only have limited space too, but they have to take you, right? They're like almost the last resort for some people. That the voluntary agencies might not have something safe for that person, so then the state absorbs them and places them. There's so many things in the news about state-operated homes. I'm very close friends with some of the DSPs that work in those situations. It's really difficult for the staff and the people living in those homes right now. Over Christmas, I had friends that worked 4 days straight. They didn't get to go home. They missed their Christmas. They didn't see, one person couldn't go to grandma's funeral, another person missed their, best friend's wedding, because there's nobody to come to relieve you. And I only bring up that difference because they're making $50,000 a year to start. So when everybody's saying like, we need more money, I agree. We need to pay people fairly, but that's a really good example of we are paying a pretty decent wage, but the work conditions aren't good. You can't, just like the prison guards, right? You can't expect somebody to get locked in at work and not be able to leave and not have there be an issue, because people need some control over their schedule and autonomy, just like our loved ones do, the people who support them. So when we advocate, we have to advocate for everyone in the home. The agencies are not getting the same benefits as the state-operated homes. And self-directed doesn't get any of those. Like, we still pay property tax, and we don't get the higher SSI. Like, maybe we need to just level the playing ground so that there's not such distinct differences between the different categories, because the way we have it right now, we can't serve all the people who need it.
I guess that was my next question is, are there states that are, so is this a nationwide crisis? Is this, Is New York in better shape, worse shape? And are there systems that are in place that are working better than what we're currently doing? Where can we advocate, I guess,
Yeah.
if somebody's gonna pick one point to advocate relative to housing, what could we do first?
Well, Autism Up, Heritage, Starbridge, we all worked on this together, right? So First Place is based out of Arizona, but they do these housing studies across the country, and so now they have national data. And so they see the trends. You can go on First Place and look up other housing analyses, and you can see Arizona has some really cool things. They really do. But they are really, really focused on neuro-inclusive communities and transition academies. Is it perfect? No. And then New Jersey has some really cool things, and Michigan has a couple of really cool things, but none of us are doing it perfectly. But this, I hope being part of this, we can move federal legislation or really drive our local and state legislation to meet our needs. Because right now we have so many barriers. Like they're talking about how they want to help the person and they can't, or the hospital wants to discharge them, there's nowhere to go. We're all just have our hands tied right now. Some of the rules in place were to protect us, so we didn't do Willowbrook again, right? That scary institution. So we said, we made up rules so that would never happen again, but now that makes it so I can't go live in a community with people like me if I want, right? Like, because then it's considered segregated. So I think that it comes down to wording sometimes, but at the same time, this is definitely a national crisis. In New York State, I'm afraid to talk about Medicaid. In New York State, we're in a better position than a lot of states. You know, if you were living in Alabama and it's an 80-20 state, and Medicaid got frozen or not, wasn't going to be the same way, it'd be a really big deal. It's not that it won't affect us, it will definitely affect us, but I think New York State has a better standing in some of those issues. But we aren't doing it perfect.
I have a question for Josh. I wonder if you made a comment on not letting, I think it was like not letting your fear kind of decide where you want your child to live. But can you talk, I feel like we've been very much on the certified settings, the pros and cons, some of those pieces. I'm wondering if you could share a little bit some of the cool things that are happening within the non-certified settings, or even just some of the, so when we do our survey at Heritage of the folks who live in our certified settings, a lot of feedback we get is things like, I don't get to choose my roommate. I don't get to choose where the house is. Like some of those pieces you just don't have control over when the certified settings, where you are living. Just curious if you could show some of the cool things or pros of the non-certified options.
Yeah, that actually kind of ties into what, Heather was just saying that our hands are tied a lot, but, in non-certified at least, we're helping people move into their first apartment. I am personally helping somebody move into their first apartment at least once a month. So, people are getting into housing all the time and they're excited about, this opportunity to kind of take on their own independence. There are a lot of different things that, people, again, one of the tricky things about self-direction is that it's very person-focused and very person-specific. So everybody's plan for success living independently is different. But, we're doing a lot of things with, the transition stipend is something that is out there where when somebody applies for the OPWDD housing subsidy, they're also eligible to, if it's their first time moving out on their own, they're also eligible for up to $3,000 for startup items needed to establish a household. So we've been able to use that transition stipend to get people like brand new furniture when they're moving out on their own, so that they're set up for success. They have a bed, they have bedding, they have dishes, they have the things that they need that they wouldn't otherwise be able to get on their own to actually successfully live independently. And then we're working with their FI and their care plan and their broker to make sure that they have their staff hired and the staff on the schedule that's going to work for the person, whatever skills that they might need to keep their their households, so staff might work with them to keep the apartment clean or do meal planning, like I mentioned before, you know, get out in the community, so they're not just, yeah, I'm in my apartment and only in my apartment, but actually, you know, get out and be, you know, integrated in the community around their apartment, and things like that. Not sure if that answered your question or not, but.
So it sounds like there's just a different degree of independence and decision-making that would, you know, that they'd be enabled, that they'd be empowered to be able to do.
Yeah,
You
absolutely.
won't know unless you try it, and I know that's really scary. My daughter had a service dog, and that's how some people have met me. And she was 3 when she got her service dog, or maybe 4, and to win our court case and to prove to everybody that she should have this dog, we had to say she was the handler. And I was like, she is like, and the dog is this big, and how is she handling that dog? But because that was the expectation, I'll tell you something, Devin handled that dog. She learned gestures and signs, and because she had to rise to the occasion. But if we always had a dog handler walking around with her, she never would have. So I do completely agree that sometimes we have to take a chance. We have a safety net, have a contingency plan, but take the chance, because we don't want to hold our kids back. If 90% of our kids don't have a livable income, we're doing something wrong. Because a lot of the people that I've worked with over the years, they should be gainfully employed, right? You know, and so we've missed the mark at some point, so we have to adjust. And I think that's one of the beauties of self-direction, is you can kind of figure some of those things out. But we need the sustainability piece. We need the house manager who's gonna still be there when we're not, you know, and that's where I think that would be a huge win for families if we could have a budget line for that.
When you say that you have to exhaust all possibilities in a non-certified setting before considering certified, does that involve actually placing somebody in a non-certified setting, like you would kind of a least restrictive environment in a classroom? Or does it involve just having those conversations and saying that's not appropriate for this particular individual?
There's gotta be a lot of data at that point sometimes too, like, you know, if it's not safe.
Yeah.
Yeah. Yeah, so people look for non-certified options first, and just like, you know, they're either self-directed, they've tried to find housing. Like, we've had families that have, you're talking about pooling resources,
Yeah.
where they will buy a home or rent a couple apartments, and then they have like 2 or 3 other kids all living together, and like the family all use their budgets together to kind of help to
Share
staff,
staff.
yeah, exactly. So that's one way to do it, but again, it's not easy, you know, and there's challenges with that. I mean, hopefully, we've heard a lot of really good success stories of that happening, but you don't have to like live in a non-certified setting first, and it didn't work out, and now you can live, you can just basically, if you prove to OPWDD that we've looked at all these options, there's nothing that we're able to find that can specifically support our loved one.
And you have to look at all the other resources, community-based resources, like maybe the pharmacy puts everything in blister packs and you don't have to have someone set up the med tray. Maybe you have CDPAP or home care come in to complement your self-directed staff so that you have the 24/7. It's just unfortunately not one system that you can check into and say to the concierge, I need, blah, blah, blah. And,
Yeah.
oh, it changed and now I need this, because now you're knocking on all these different doors. And if we could knock on one door and tell New York State what we need, and then it gets fed to the different people who can help us, that would take a lot off the parent. Because I think that's what care managers are supposed to do, and I have no idea how they could possibly navigate every system either, you know?
If somebody doesn't have OPWDD, or where, like, who would be their unofficial care coordinator? Like, who would they call? Who would they say, hey, I need help?
You can get, like, there's care management, so there's like health homes, which is basically health homes, like, for example, the Arc of Monroe has our own health homes care managers. So they do not have to have an intellectual disability, they have to have a qualifying medical condition and Medicaid. And as long as they have those qualifying, you know, it's either a dual diagnosis, qualifying medical condition, but Medicaid is the biggest.
It's just
Piece.
because the Medicaid piece
Yeah.
isn't very
Okay,
important.
but with that, in that case, you don't have to have OPWDD, and you get a care manager that can assist with that navigation, or helping those resources for housing. So as long as you know, and again, we're not feeling like there's many agencies that have that, there's many places that specifically that's all they do, is just offer like a health homes care management through state. I mean, through the state, they offer that too, so.
I think where you're gonna run into the difficulty is if you have mental health and IED, because then both systems say,
Right.
That's
Do
yours,
you go
that's
to
yours.
SPOA, the
Yeah.
single point of access
Yes.
for Office of Mental Health, or do you go to OPWDD?
Right.
And you can't do both.
Yeah, generally speaking, I think that folks who are dually diagnosed come more to the WDD side because there's more robust services.
Yeah.
So we kind of rolled over a little bit because of our late start. Does anybody in the audience have any more questions? Do you have any final thoughts on the panel that you'd like to say?
I think we just have to keep talking out loud and telling our stories, because if we keep it private and we keep it behind a closed door, none of our neighbors know what we're going through. And they're less likely to get on board and help when we're struggling, right? Because they just don't know what's happening. I mean, when I explain to people that Devin has 10 caregivers and I'm coordinating that and I'm trying to work and do all these things, people are like, oh my gosh, how do you do that? Because I have to. I don't have a choice, right? And my other 3 children also have disabilities. So I'm always thinking of ways to advocate, but I think one of the most powerful things we have is making an appointment with your local legislator. You don't have to tell them a problem, just tell them what's going on. Tell them that some of the barriers they're facing or something that would help. You know, the transportation piece is so huge for our loved ones. If you get the apartment, that's great, but if there's no way to go anywhere, you're still stuck in the apartment. So I think those conversations and living out loud and not being embarrassed. We're not doing anything wrong, we're just struggling and we're trying to make do. So that would be my advice.
Yeah, I think, housing as a concept is giant and daunting and scary. So, as much as you can, kind of breaking it down, and like we said, having those conversations early on and often and repeatedly with your team and with your loved ones, to really know, what for this specific person, what is going to be the best plan. When you're looking at it from a zoomed out lens, it's terrifying. So really kind of zooming in to go just piece by piece, step by step, working through the process that when that time comes, hopefully you're feeling more prepared, your loved ones, your care team are feeling more prepared.
And have your next in lines. I don't know if everybody uses that phrase, but I was at an agency that used it all the time. The people who also know that, like the aunts, the uncles, the cousins, the siblings, the other people in your family who, if you get hit by a bus, that they're gonna step up and they're gonna know what the plan is. Because I think that's the scary part for people in our position where families come to us and they say, we don't even know who the care manager is. Like who are we supposed to call? So they could be calling ARC and they're in Heritage, like they just don't know. So we have to make sure that we're doing those things and keeping track.
All right, well, thank you all for coming. I appreciate Autism Up, the Arc of Monroe, Heritage Christian Services, and Starbridge for being here today. This was a wonderful presentation, and thank you, everybody.